What is an MCL injury of the knee, and what does it mean for you? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education, insight, and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. One of the most common injuries in sports, especially what we call contact and collision sports like football and soccer, is an MCL injury of the knee. This is a big, thick ligament on what we call the medial side or the inside of the knee, the side closest to the midline of the body, as opposed to the outside or the lateral side. Big, thick ligament on the outside of the knee. It's very often injured in what we call a valgus stress, where your ankle is toward the outside compared to your knee. One way to do that would be another player hitting you on the outside of the knee, forcing your knee inward and opening up the medial side or the inside of your knee. You could also do it by planting your foot to change directions with side-to-side motions and injure that ligament as well. It's very common. Now, you can injure that ligament, that MCL or the medial collateral ligament, by itself, or it can be a combined injury like a meniscus tear plus MCL injury, or more commonly ACL injury plus MCL injury. That spectrum or combination of injuries is sort of a different discussion. A lot of times it's the other injury, like the ACL injury, that really dictates treatment. What we're going to talk about here is an isolated MCL injury, or an MCL injury that occurs by itself. So what that typically entails is non-surgical treatment. That's good news, right? You almost never need surgery if you have an isolated MCL injury. What is done to treat it is basically you put the athlete in a knee brace that lets you bend and straighten your knee, flex and extend your knee, but it prevents side-to-side stress on your knee, that valgus stress on your knee, to help that ligament heal. You know, how long it takes to get back really depends on how severe the injury is. You'll hear the terms grades 1, grades 2, and grade 3. That's based on physical exam, how much the knee opens up when you test it, and it's based on what it looks like on MRI. Generally, what grade 1 means is that that ligament, that MCL, is just stretched out. It's not completely torn. Grade 2 is usually some sort of partial tear of that ligament, and then grade 3 will either be a complete tear of the ligament in the mid-substance, completely apart, or it pulls off the bone on the femur, the thigh bone, or the tibia, the shin bone. The higher the grade, essentially, the worse the injury, the longer it takes to get better. So grade 1 and grade 2, or grade 1 I should say, takes about 1 to 2 weeks generally. Grade 2, maybe 2 to 4 weeks. Grade 3 can be up to 4 to 6 weeks. There are some grade 3 injuries that occasionally need surgery, so that's why if you suspect an MCL injury, that's one of many good reasons to go see an orthopedic surgeon, just to get a full diagnosis and get the right steps to treat it so that you can get back to sports and exercise quickly. But there are a rare number of MCL injuries that need surgery, and so that's important to know. Plus, if there's concern that it's a combined injury, ACL, MCL, that kind of thing, that gets to where very often we'll talk about surgery to treat, that spectrum of injuries. So another good reason to see an orthopedic surgeon. Okay, have you suffered an MCL injury, and how did you treat it? How long were you out of sports or exercise? I'd love to hear your experience. So below this video in the comment section, leave your experience. Describe how you got hurt, how the doctor diagnosed it and treated it. I'd love to read it, and I bet people all over the world would love to hear your experience as well. If you like these videos on sports and exercise injuries and surgeries, I record a couple of these videos every week, certainly one of these injury and surgery videos every week. If you see these on Facebook, terrific. Comment in the comment section below if you want to share your experience. But if you want them delivered directly to you, go to my YouTube page. I have a channel, Dr. David Geyer. Click the subscribe button on the upper right corner of the page. You'll get these injury and surgery videos delivered directly to you. Thank you so much for watching. I hope this video on MCL injuries was helpful. I look forward to seeing you right here next time.